This is Duke University.
So this is a new series in the Health Humanities Lab. It's called The Doctors Are In, Conversations in Humanities and Health. And it's a talk show style series in the third week of every month, usually on a Thursday, although occasionally if our speaker lineup can't make it on a Thursday, we'll do it on a different day of that week. And for these events, we invite a humanities faculty member and a healthcare provider or healthcare researcher to engage in conversation on their mutual interests in their separate practice frameworks and on where their doctor credentials, PhD, MD, or both, have taken them in their professional careers. So tonight we begin with the incoming director of the Franklin Humanities Institute, Ranjana Khanna, in conversation with psychiatrist and psychoanalyst Dhipthi Mulligan. And I will first introduce Dhipthi Mulligan. So she is a psychiatrist and psychoanalyst practicing in Durham. She was previously based entirely in Duke Psychiatry, and she retains her affiliation there. Prior to obtaining her MD, she studied comparative literature at Cornell University, and then her medical degree from the University of Florida, and completed her residency in psychiatry at Duke. I had the privilege of working with her on her fourth-year research project, which was a wonderful study of the neurobiology of metaphor in psychiatry and psychoanalysis. She is a consulting associate in the Department of Psychiatry, and her clinical practice entails treating adults in an outpatient setting using psychoanalysis, psychoanalytic psychotherapy, and medications. Her educational role in the Department of Psychiatry includes directing the psychodynamic psychotherapy practicum and teaching the trauma and language course and supervising individual residents in psychodynamic psychotherapy. So really a wonderful, rich, and very humanities-imbued career. Ranjana Khanna is professor of English, literature, gender, sexuality, and feminist studies, and the former chair of women's studies, as GSF was then known. I have really the greatest admiration for her as a scholar and an administrator. Her research focuses on post-colonial studies, feminist theory, psychoanalysis, literature, and political philosophy. She is published in journals including Differences, Signs, Third Text, Diacritics, Screen, Art History, Feminist Theory, and Public Culture. And her books include Algeria Cuts, Women and Representation, 1830 to the Present, and Dark Continent, Psychoanalysis and Colonialism. Her forthcoming book is called Asylum, and her next monograph project is Technologies of Unbelonging. And so we're just going to begin by having each of them talk about what first led them into psychoanalysis. And after they have talked on various topics for about 40 minutes, we will ask people to get refreshments from outside and come back in and engage in Q&A, and then we will just seg completely into reception mode after that, okay? So thank you so much for joining us.
Okay. Why don't you go first?
Okay, so as the clinicians in this room will already know, a question like what brought you or what made you interested in psychoanalysis is inevitably a loaded question. There's never really one simple story or one answer, and if there is, then you haven't looked deeply enough. But I usually tell the story in somewhat the same way. I think, I've been interested in psychoanalytic thought, probably from the side of philosophy, just early on in high school and college. But I think it really grew into what it is today during my residency, just my interest in working with patients, doing therapy, and then the kind of therapy that I was interested in. And I found that psychoanalytic thinking allowed me to very easily bridge the biological, the medical, with the humanities. It wasn't simply listening to a story, but it was a reading of the stories in a very different way than what we're generally, a different way than how we're generally taught during the course of medical training and residency. So I think, and that's when I started psychoanalytic training. So I went to the institute, took all the classes, saw the patients, and I think it's exploded since then, because one of the things that I found to be particularly compelling about psychoanalysis is that there is obviously a lot of theory. It's rich theory, it's complicated theory, but it comes alive most when you are using it to help a person. And psychoanalytic practice allows me to do that, and I think that's the biggest influence right now in terms of maintaining my interest.
So I first came to psychoanalysis through feminist psychoanalytic theory. When I was an undergraduate, I was studying literature, and there were various texts that were taught in a class mostly on literary theory. And they included works by a feminist theorist who worked on psychoanalysis. There's also a linguist, Luce Irigaray, and also the works of Julia Kristeva, who's a practicing analyst and also someone who works on literature still, and political theory, in fact. So I came to psychoanalysis through a critique of it, but a critique of it that was quite particular, I think. The critique was one that was informed by a mode of reading that was important in France during the intellectual formation of Luce Irigaray and Julia Kristeva in slightly different ways, and that is deconstruction. And what that meant was that the form of critique that was involved was both intrigued, interested, highly invested in many of the questions that psychoanalysis allowed for and explored, while at the same time demonstrating some of the problems, really in some of the normative structures of psychoanalysis that were being developed, but also to look at how psychoanalysis was a philosophy, right? And how psychoanalysis could be used to understand certain modes of philosophy in the Western philosophical tradition. So, for example, someone like Luce Irigaray would be doing a reading of Plato next to Freud and trying to understand something like Plato's understanding of the arts through the metaphor of the cave as a repressed uterine metaphor, for example. Right. So the work was using psychoanalysis to some extent against itself, looking at how the metaphors of female sexuality, for example, in Freud, and femininity more broadly, I suppose, were very much a product of his moment, very much a product of late 19th and early 20th century Vienna. But also they were, all those texts of that moment were intrigued by the way in which he was trying to deal with the question of sexual difference more broadly. How is it that we understand what sexual difference is? And that came to be something that has informed my thinking ever since.
Just associating to what you're saying, I'm teaching a class right now at the Institute. It's a basic class, Models of the Mind. And so it involves going somewhat sequentially through the different psychoanalytic models, the topographic, structural, and this idea of sexual difference. We've been reading a bit of Freud in this class, and my first response, my first reaction to hearing the phrase, sort of that there is no such thing as sexual difference in some of what Freud writes. Right. That it really is just the male, the masculine, and how much of the feminine experience is folded in or seen through the lens of the masculine. And,
right.
In such a way that a phrase like that would be pointless, almost.
Right, right. And I think that in many ways, I mean, someone like Luce Irigaray was also trying to deal with this question. She talks about the logic of the same, right? An idea of the same that informs any theory of the subject, and so she precisely talks about how we only have the masculine at the moment, and sexual difference is something that's yet to be imagined, and that becomes a moment of possibility in her writing as well. And so that's something that continues to be intriguing to me. One of the things that we had thought that we might talk about, we had a list of various things that we might talk about today, and one of them was pregnancy, and perhaps for obvious reasons, for reasons of the logic of the visual, it might be obvious. So I mean, one of the ways, what I was just saying about the metaphor of the cave, I think is quite interesting in this regard, because for some of those feminist thinkers, there has always been a repressed idea of pregnancy and gestation that cannot be articulated as such in the history of Western philosophy, and with that, what goes along with that form of repression is, in a sense, an idea of writing and an idea of subjecthood and an idea of the possibility of articulation with any kind of authority that relies on implicitly on a kind of masculine parthenogenesis. So I think that that there's a way in which that idea is informing lots of notions of writing generally, but certainly philosophy.
Part of my interest about it, in terms of pregnancy, aside from the personal interest at the moment, has been through my work as a psychiatrist with kind of the perinatal population. I see a lot of women who are either currently pregnant or have recently delivered, and they're struggling with different issues, whether it be mood disorder, for lack of a better word, or traumatic stress. And just listening to you talk, Ranji, I was thinking about this shift that's that's happened over the past few years, where there is more of an interest in perinatal psychiatry, more of a focus, but wondering what kind of focus it is. At the risk of oversimplifying it, into just two categories, but is there a masculine approach to the issue of pregnancy? Certainly there's an effort to overlay the biological, to explain it as purely hormonal, for example, that it's because of a shift in the hormones either during pregnancy or immediately after delivery, and that's why this woman or that woman has whatever problem they have, as opposed to, or in addition to, thinking about what else would be going on. What is the experience of the woman? What is the feminine experience of getting pregnant, or not being able to get pregnant, or losing your pregnancy, or getting all the way through the pregnancy and then having this change in the role, and how does that affect someone psychologically and emotionally, and what would we do to support and treat issues that come up? And I think it's not quite as focused on the literary. What I'm saying is not quite as focused on the literary, but I think it's perhaps a concrete manifestation of similar issues.
Yeah. I mean, I think it's interesting because one of the things that we were also just talking about before is that that in many of the classic psychoanalytic writers, so Freud, Lacan, Anna Freud, Melanie Klein, what you have is a kind of avoidance of the issue of pregnancy as well, because in a sense psychoanalysis is so invested in the position of the child, right, and the adult's former life as a child as well, that in a sense the question of pregnancy just never really is adequately dealt with until you get a big change in the way in which psychoanalysis is understood. So I have a very interesting PhD student at the moment, Rachel Greenspan, who's just finishing up her dissertation on psychoanalysis in Argentina, which is where currently there are more psychoanalysts per capita than anywhere else in the world. And apparently 90% of them are women. And there's been this long history of interest in different kinds of psychoanalysis as well. So in the early years, Klein was very important in Argentina, and now in more recent years, it's been Lacan. But one of the chapters that she's been working on is on a psychoanalyst, Marie Langer, who wrote quite a lot about pregnancy and miscarriage, and the psychosomatic as well. And I think one of the things that has come up in relation to her chapter on that is the whole question of wanting and not wanting a pregnancy at the same time. And wanting and not wanting the presumed result of a pregnancy at the same time, and the kind of split that goes on in one's own sense of subjecthood as a result of that. Both literally, one is more than one during a pregnancy. And in a sense, in say the terms that I was talking about before, in terms of Luce Irigaray, there's some kind of idea there about the way in which you might understand that experience as being more than a subject and less than a subject at the same time, right? In a sense that one doesn't have the same kind of sense of the I, sense of self, when there is more than one. And on the one hand, that might be experienced as hospitality to the other. And on the other hand, it could also well be experienced as a kind of parasitic relationship, occupation. Right? That an occupation, exactly. Occupation is a nice way of thinking about it. So I think that there's a way in which some feminist, she wouldn't have called herself a feminist psychoanalyst, but certainly someone who's really working on the question of pregnancy, and particularly of miscarriage, and those what you were talking about, the early months with some of the emotional dilemmas that might come up. She's trying to think about that in ways that are wanting to acknowledge the ambivalence with which many women experience pregnancy, but nonetheless find it difficult to acknowledge.
There are a variety of kinds of ambivalences that are addressed and studied more specifically, and you're right that pregnancy is not focused on with quite as much rigor in at least in clinical psychoanalytic writing. And I find that sort of humorous and I guess informative when you think about a concept as classically analytic as penis envy, for example, that we don't as commonly use a phrase like pregnancy envy,
right?
Even though this is a particularly unique experience, a uniquely feminine experience.
I'm curious about whether you feel that your background in comparative literature has informed your psychoanalytic practice. I mean, I know that you said at the beginning that yes, you were interested in philosophy and that you had a different sense of the stories that are told. But I'm just wondering if you can just expand on that a little bit more. And
sure. I think it has influenced my practice, my thinking quite a bit, and I would say that it makes it feel a bit more organic to be listening to stories. And I think without such a background, you might, I guess, I imagine that you might rely on the theory a bit more, or the conventional story, the conventional psychoanalytic stories. I think one way that I've noticed my experience to be different is that I can pay attention to the way the story is told. And I think this would apply to patients in psychoanalysis, but also patients I treat with medications only, for example. Just new people I meet for the first time, whether their story has a clear beginning, middle, or end, and what kind of beginning is it? Do they start at the end or do they start at the middle? And what does that mean about how their mind is working right now, or why would they need to tell their story in this way? And I think you get quite a bit of practice in thinking that way when you have a background in literature, when you're used to reading that way and writing about what you've read in that way. So that's, I think that I would say that's the primary way in which it influences me.
And when do you understand your psychiatric work as being quite distinct from your psychoanalytic work? I mean, I'm curious to know how you Yes, whether there is a separation there for you, or whether you always feel like you're bringing psychoanalysis to your psychiatric patients, and yeah.
I think I'm always bringing my psychoanalysis to my psychiatric patients. From the minute they call me, the way they leave the message, whether it's easy to call them back and get a hold of them, all of that reveals something about this person. And so I'm always reading with that lens. I might not always put it to use in the same way, in the sense that if I'm seeing someone for medication and they have their own therapist, I'm not going to be making interpretations just because. But I do find that even if someone is not in psychoanalysis proper with me, that I can make use of the psychoanalytic concepts and how I interact with them, and even how I explain things to them. I find that people are more often than not quite curious about themselves, and being able to find the right words to explain some aspect of their mental functioning goes a long way. And I think the psychoanalytic way of doing that is quite effective.
So I'm actually also curious, if you don't mind, saying something about the neurobiology of metaphor.
It was, I want to say many years ago, but I think it's been 4 or 5 years ago. But I have a particular interest in metaphor, I think primarily because of my background in literature, and I listen for metaphors when I work with people, whether they use a metaphor first, or if I use a metaphor first, and if I use a metaphor first, whether they are able to pick it up, do they reject it, do they expand on it, do they make it into something that's concrete? And so I was operating in that way, working in that way already. And, I think it was, I'm trying to remember if it was in the context of a course or how the two came together. But there is certainly this kind of this war or dichotomy between neurobiology and, or there can be, or there has been, between neurobiology and psychoanalysis. Or are you a biological psychiatrist, or are you a kind of a therapeutic psychiatrist? And to really see, I was interested to see how and or if and how you can bridge the two together. And metaphor is a simpler construct to study, I think, than some of the other things that you encounter. You can isolate it a bit more than how someone tells an entire story, for example. So it was mostly a literature review to see how metaphor has been understood in psychoanalysis, and there has been a moderate amount written in the psychoanalytic literature about metaphor itself, and then to see how that correlates with the parts of the brain that process metaphor. And I think the science is still nascent in that regard, but there's some overlap in terms of the parts of the brain that help process metaphor are also the parts of the brain that help us kind of relate to people, to understand someone else's intention. And which in a way sounds pretty simple, pretty obvious, I think. But putting the two together has clinical value for me, because you can then intentionally use metaphor to assess, to evaluate, but also to develop a person's capacity to mentalize another human being, to mentalize their own experience. So there's a potential for growth there.
My dissertation, my PhD dissertation, also had metaphor in the title, which is so funny. It was Dark Continents, Metaphor, and the think, and the politics of exclusion, maybe something very clunky. Anyway, it sounded very clunky at the time. But metaphor is something that was interesting to me because in a similar sort of way, I think. I mean, not in terms of the brain, because it might seem obvious to you, but it's completely unobvious to me what's going on in the brain. But what was interesting to me is the way in which metaphor isn't just about the replacement or the sharing of one by the other, but in fact it's a proliferation of ideas that are there in the metaphor. So it's always at least four ideas that are coming up with the metaphor, in the sense that it's as much about commonality as difference, and about the repression of difference as much as it is about the marking of and opening up of that difference.
It makes me think of Deborah's original proposed question for us about, is psychoanalysis always literary? And I think, originally, perhaps I was thinking about it as along the lines of kind of literary theory. But as you were talking, I realized that the way that I'm thinking about it, the literary is the therapeutic, because I'm thinking about the literariness of metaphor, the literariness of language, as actually affecting change in an individual, in their psychological makeup. And so I guess I'm in a way surprising myself that I would answer yes, but not in the way that I thought I would answer yes. That it would be literary in a clinical sense.
That's very interesting. Yes, I mean, one of the things that I thought of in relation to that question also is the different ways in which Freud's work is now being has now been translated. The standard edition of the complete works of Freud was revised by Mark Soames in or I think is still being revised. I think he's still at it, and he is very much on the neuroscientific side of psychoanalysis. At the same time, there's the translation going on with Adam Phillips as the editor, although he doesn't actually know German. So he's been picking on finding people to translate different texts by Freud, but precisely not using the terms that have become the technical terms through the standard edition, and the idea there being that he's drawing out the literary Freud, and I think what he means by that is I don't think he means where Freud is looking at literature, right, which I think is sometimes good and sometimes just terrible reading of literature. I mean, sometimes it's pretty interesting, but I think he's actually getting at something that you're talking about. That in a sense, the theories that are there are theories that are, in a sense, formed alongside a certain kind of understanding of language and the way in which language works, and how one might, how one may and may not communicate through language, and how language often isn't about communication, right? In a certain way. So. I think, for me, the question of translation has always been quite interesting in psychoanalysis because, well, for a couple of reasons. One, it's interesting to me that the standard edition of the complete works of Freud circulate more than any other kind of Freud, right? In the sense that more people read it in its English translation than in the German or in any other language. But also because I've been interested in international psychoanalysis for a long time now, about how psychoanalysis is and is not only a product of late 19th and early 20th century Vienna, that it's very much a field that was built in relation to other people working in different languages, through letters from people in institutes in South Africa or in India, trying to work out whether psychoanalytic frameworks functioned as well in those other contexts. And also I've been quite interested in the whole question of bilingualism or multilingualism and psychoanalysis. And so I had a question for you about that. And that is that how do you deal with the question of multilingualism, bilingualism or multilingualism in a clinical setting?
In a sense, it's easy for me to deal with it. Be a little humorous here in that I don't do analysis or any other kind of work in a language other than English, but
it's one way of dealing with it. Yes.
But I do. I'm just thinking about people I've treated whose primary language is not English, and that they speak English well enough for us to get by, and I think. The place that we really address it is again in the literary sense, when there is some figurative use of language that I might not understand, or that they might not understand, and in that moment we really have to confront the real difference that exists, and you can't just interpret that away. It has to be addressed, and I think I also see it in the supervision that I do. That some of the residents are not from here.
Right.
They've immigrated from. I have someone who's immigrated from India. I have someone who's immigrated from Africa, and they're doing psychodynamic therapy. And again, we have to confront it, not just as something that needs to be treated in the patient, but also, how do these two people come together and do common work when there is this difference that you can't. Well, you could ignore it. It would be bad work if you ignored it. But how do you address it in a way that's therapeutic and in a way kind of true to analytic principles as well. And I think you have to, at least the way that I've managed to do it, is you have to walk a fine line where you have to acknowledge the difference. I don't understand this phrase that you just used. Will you explain it to me? And then to also understand, why they would choose that particular phrase, or perhaps even why they don't choose any phrases that are closer to kind of their linguistic experience. Right? If a patient is conscientiously and chronically using language that he or she will know I will understand, that also informs me about them. So it's generally not pretty, but we kind of stumble through it. And I guess the other way that it comes across, I don't know that I've done as much as I need to or could about this, but there's the issue of looking different, right? It's obvious when someone comes to see me that I'm Indian of some kind, whether I was born there or not, and my name is a mix. It's Indian and it's Irish. So to think about whether they've had any imaginations about that, whether they ask about it. So I've probably not confronted it as much as I need to, but it is always in the room with me, I think.
So I'm also, I think that in the literary fields, there are a few figures who have become very important, and to some extent even in feminist psychoanalytic work. And Freud remains very important, right? Jacques Lacan remains very important. Melanie Klein remains very important. And then there are a few other, figures who seem more peripheral, say Anna Freud, Bion, occasionally Adam Phillips or Fonagy, or one of these types. But I'm curious about the status of those sort of iconic figures in for you and in clinical practice. I mean, do you feel as if some of the issues that there may be with Freud, I mean, some of the things that mark him as a man of his period, as it were, mean that you leave some things behind and you go to other figures who have worked on this more? I'm interested about how much you're engaging with the same kinds of texts that we tend to engage with in the humanities.
Sure. I guess I'll speak to the culture of psychoanalysis or psychoanalytic education, and this is one person's opinion. I'll put that out there. And I think I've been interested in this as well, this idea, because what I've noticed when I think about how it is kind of at the Institute, for example, there's almost kind of a reactionary push against Freud. Kind of a moaning and groaning if there's a lot of Freud to read in a class. Some of it for good reason. He's not exactly the easiest person to read, but and maybe even a feeling, that what he has to say is all antiquated. That psychoanalysis here today is relational, for example. So that's one kind of shift, and it's been interesting to see when I interact with Deborah, with other people in the humanities here, that there is still very much an interest in Freud, quite a bit of referencing his texts, and so I see psychoanalysis being kind of lived in very different ways in these two places at the same time. And rarely do the two actually speak. Right. I
mean, certainly there can be some moaning and groaning in the humanities classroom as well when there's a lot of Freud to read. It's not that it's not that people are necessarily all accept. I mean, there's a lot of resistance as well. I mean, I remember one student, after we had gone through the basic Oedipus complex, and we were trying to piece it together through all the different sorts of texts that touch on that. And she said, well, I think this is just nonsense, and I don't think we should be reading this at all. And it was extraordinary to me because, there are lots of texts that we're reading in that classroom that she may have disagreed with in some way, but it was all-out rejection, and she felt totally at ease saying that a body of thought that after all created a whole field was just nonsense. I mean, it was quite interesting to me. So certainly there are resistances on all sorts of levels. Certainly with Jacques Lacan, it tends to be on the level of the difficulty of the text. And, I think that no one would disagree that those are very difficult
I might have
texts.
some of that resistance.
Yes, I might have that resistance myself, even when I assign the texts. But but yeah, so I mean, I think that there is still that kind of resistance, and there is also, to some extent, some questioning. And this is more in the undergraduate classroom, where you have students from across the university, or at least across the arts and sciences. An idea that, in psychology, this is more of taught more as something in the history of psychology that we don't, was kind of an embarrassing mistake, and has been moved on from. So I think that there's that sense among some of the undergraduates. With the graduate students, they know that there's a body of critical theory and literary theory that they need to understand. If they are going to, then, even if they choose not to work in that area, they still have to understand it as students of literature. So it's a different type of issue, I think, that's addressed. So.
I'm really interested in the idea of somatic metaphors, when you can see the person's story playing out in their body. And I don't know if you've looked into that literature. I mean, the whole psychosomatic literature is full of this, and it's largely, when I went through medical school 30 years ago, psychosomatic was like a pejorative term. And I now have a rheumatologist mentor in New Zealand who's also a psychiatrist. Probably the only guy I know in the whole world like that. And he looks at his rheumatology patients through the lens of somatic metaphor. And he says a quarter of his patients have a frank somatic metaphor of their stories playing out in their body in a way that, if you're trained to look for that, you can see it. But Western clinicians are not trained to think that way. So the most glaring example is the frozen shoulder. Which is, as a radiologist, I'm really intrigued by that because it's a very common problem, particularly in middle-aged women, and there's no explanation for where it comes from. And it's considered idiopathic or mysterious or enigmatic or whatever. But when you start working with people with frozen shoulders, there's often a repressed emotional block. And just to stretch the metaphor as far as we can, it's the middle-aged woman who really wants to punch her husband in the face, but that's really not a socially appropriate thing to do, so she just freezes her shoulder. And it actually plays out in the body as an angry-looking synovium that causes the shoulder not to be able to move. So I'm curious as to what you've seen from your psychoanalytic training and how that plays into it.
I think the best example I can give you right now, a patient in analysis, and for probably the first year and a half of his treatment, when he was, he's lying on the couch, and he would just be picking at his skin or his face, and just always picking. And I think over time, as we talked about the very critical nature of his father, and it was put into words, there's no picking that I notice now. And I think that is a somatic metaphor. It's along the lines of hysteria, I would say. I would think of hysterical symptoms as metaphors, really, in terms of what the story is behind what's wrong, or what has been wrong. But I think I see it with patients. I'm trying to think with patients who are not in intensive treatment, also, things like migraines, conditions like fibromyalgia, right? That's I think that's one big whopping metaphor, right? Sort of kind of life hurts, existence hurts, and you have kind of pain all over. With migraines, this is not to say that migraines are not an organic entity as well. They are, but the same patient who picks at himself also gets migraines, and it's usually when there's some kind of aggression, some attack, and instead of that actually showing up, he gets a migraine, he takes to bed. And so he's demonstrating through metaphor what he can't put into language. So it's a very common phenomenon, I think.
And what connection does it have to the history of trauma? Sexual or physical trauma. And I'm not a student of Freud since my one course in Duke undergrad in the 70s. But you use the term hysteria, which I've read just a little bit about Freud saying that, well, actually Freud was discovering that there was a huge amount of unacknowledged sexual abuse back in Vienna, back in the day, that really couldn't be acknowledged. Like what's happening now in the popular culture in the last 2 weeks with all the sexual abuse in women is coming out now. People are talking about it, so instead of having to admit that there was that much sexual abuse going on in Vienna, he had to come up with another way of translating it in a safer way that would be culturally acceptable. I mean, in terms of the background of trauma.
It sounds like the example you're using is not one where the trauma is involved necessarily, but usually it does occur when something cannot be put into words and has to be put into the body. And I think you're right. Freud initially wrote about sexual abuse and then kind of took it back, and there are political reasons and there are theoretical reasons for that. There's probably some validity to both, but.
And since you brought up the uterus, and isn't the root word of
hysteria a wandering uterus?
Uterus,
right.
Okay. No.
Right. And I was thinking of this very recent event that's still going on in Kashmir. It's a region in India. And very recently, cases about braid chopping have come in, where a lot of Kashmiri women are saying that they're doing their work and they're going about their day, and this is generally happening in the second half of the afternoon with them, where they're like, suddenly something happens and we see somebody who comes and they chop off our braid, and for 20 minutes we're unconscious. So the police has been trying, and there's the chopped braid is lying outside the house. It's on the road, so that evidence is there, but they've not been really able to sort of piece the pieces together and see who did it, when did it happen, and then a lot of conspiracy stories have come from there. That the woman, whosoever talked about it in so and so village has died, but when you go deeper, the person hasn't died, but there have been all these stories circulating around now, and I work in Jammu Kashmir region, so I was also trying to understand this phenomena because it's going on right now. And one of my readings, going back to this conversation, was that the region is hit with trauma. It's been undergoing violence and conflict for the past 70 years. And stone pelting was one of the biggest ways that the youth and even adults would express their anger against the bureaucracy, against the government. And the day that Trump was elected here was the same day that demonetization policy was launched in India. And that resulted in a curve on stone pelting. So the youth that was initially pelting stones and throwing off their anger stopped doing that. And now this incident has started about a month ago. I mean, I'm just drawing connections that are really broad and vague, but I feel some conversation from here is helping me piece it together.
We've been talking more about individual use of metaphor, but I think that there very much is or are collective metaphors within cultures, and how do you understand? Do you understand that by way of the individual, or do you understand it by way of the culture? Do you have to do both at the same time? My inclination is that you would have to do it through the individual, but probably several individuals to understand the cultural meaning. I don't know, you might have thoughts about that.
I mean, it's interesting because I think that from a literary theory type angle or cultural theory type angle, I mean, I think there's always this question with psychoanalysis, with psychoanalytic thought about the relationship between the individual and the collective and what it means to actually think of something as a collective trauma, whether something becomes a collective trauma precisely through its metaphorization, as it were. So I don't know. I mean, the big event, if you like, that's not an event, but a series of events that it always gets talked about as the Holocaust in relation to this. So how do you understand people being traumatized by the Holocaust when it is a series of events, right? Is it the fact of the event, of the series of events together understood as genocide or as the Holocaust and given a name as such that is the source of trauma? Is it something that happens? Is it a collection of things that happen to people individually that are then the source of trauma? And how does one understand this in subsequent generations, right? I mean, I think that that's also something that's been very important in this thinking. And so I think that in a sense, that movement from the individual to the collective is usually in some form a matter of metaphor, right? That you understand this as being collective through a name, which is also often the name that is the source of the genocidal logic that has caused the violations. So, like in the context of the Holocaust, one might say that the genocidal logic that understands the Jew as being the group that is the object of genocidal of genocide, right? That in itself is a term that then allows for some kind of sense of the collective trauma, right? But it's still working within that genocidal logic. That's completely garbled. Let me just try it in a slightly different sort of way. That depending on what a collective trauma is, right? Sometimes it's a collective trauma which is understood as genocide, right? Now, how is one person affected by that? Is it through identification with the group that is the victim of genocide? Is it through something physical that happens to that person or someone close to that person, right? But there's always a kind of collective metaphor that's going on there, which is the name of a people, right? In the instance of genocide. So there's this Vamik Volkan. He used to be at Virginia. I'm not sure if he still is, but he's written on this question of collective trauma in relation to different genocides.
I was thinking about an article in the New Yorker not long ago about these immigrant kids or teenagers who, when they found they might be deported or have their entire life completely changed and their sort of personhood changed, that they somehow became submerged in this unconscious stage, and they were alive, and they they had a pulse and they were breathing, but they were otherwise unresponsive. And when eventually someone was able to work out their legal situation and it turned out they could stay, they woke up. But it was just completely fascinating, but also that this had happened to many kids kind of like in separate communities and states.
But
So
were they
I was
all in
interested in
Sweden or
your-
Norway or something?
Were
I
they?
think
Yeah.
they were all somewhere in Scandinavia.
Okay.
Yeah.
I was interested in your comments on it. the phenomenon?
I mean, it sounds like another example of what we were discussing. This kind of sounds like maybe a group hysterical phenomenon. And what they're communicating is that it's not just too much for them to kind of live through; it's too much for them to perceive, to think about, experience, because it is such a dramatic gesture. I mean, in a way, I think hysterical symptoms they're hysterical because they're dramatic, theatrical in a way. They're acting out something that can't be spoken. But we can also think about the kind of the level of involvement, whether it's limited to a shoulder. That's right. That says one thing in terms of how overwhelming is this experience, or if it involves the entire body. If it involves the entire body in movement, so pseudo-seizure, that would be one way of kind of the whole body being involved. But here, they're basically kind of rejecting the involvement of the body by using their body. Mm-hmm. So I would think of it as communicating something to me about just the complete overwhelming nature of what they're experiencing, the traumatizing nature of what they're experiencing.
That there's this I think it's in group psychology and the analysis of the ego. Freud talks about hysteria in a girls' boarding school, and it all starts with a letter. I think it's the letter. Oh gosh, I've taught this text so many times, and now I can't remember the details at all. It's a letter that comes from perhaps a boyfriend or an admirer of one of the girls, and it generates this sort of mass jealousy, and so they all have the same kinds of symptoms. I mean, he's sort of talking about this as he's trying exactly to understand the relationship between the individual and the group in this way, and they all have the same. The result is the same on all of them, and I can't remember exactly what it is now, but it's yes, but
To be catching.
well, exactly. It seems like a kind of contagion of sorts.
Yeah, I mean, I was just thinking of a kind of social mimetic force around the awareness of how primal repression can be, and it seems to me that we live in an era in which we no longer really believe in repression. We no longer believe that we have inappropriate desires, painful associations, problematic anticipations of traumas that might actually interfere with the sort of smooth performance of our conscious responsibilities and lives.
Yeah.
And that is one of the great beauties of psychoanalysis, is that it helps people to understand that. And so I had a question for you too of whether the underestimation of the forces of repression of the unconscious, or whatever we want to call it, kind of rising up and disrupting our lives, whether we then overestimate biomedical systems and overestimate the degree to which having a named diagnosis, having a medical approval, or like a human rights type sort of labeling and approval of an injustice suffered by a group may then become over-determined, over-invested in.
I would say yes. I mean, I think that I really like the way you put that. I mean, I think that there's partly because of what you're bringing up is desire, which we haven't talked about at all. And for literary and cultural theory, psychoanalysis is in some ways most interesting in the way in which it deals with the question of desire, it does seem to me that inability to acknowledge the complexity of desire leads to all sorts of bizarre forms of naming legal transgressions. And, you know, I'm going sort of the human rights side of the question rather than, I'm going to leave the medical one to you. So for example, the difficulty around the question of desire in rape, right, which is, it's such a thorny, difficult terrain to deal with, partly because we have this language of consent around sex, which is so flawed in many ways because it does not take into account anything about what desire is, right? And so when you have, you know, and I say this as, you know, as in case anyone is doubting me, absolutely a feminist, absolutely a believer that people who have been raped should have their, you know, have justice and whatever that may look like. But I do think that there is something very, very difficult about the impossibility of expressing legally a form of desire that is not absolutely clear, but that one can nonetheless be violated, right? It's almost as if as soon as you acknowledge the complexity of desire, that you may want something and not want it at the same time, that sex may be about risk and pleasure of a certain sort and not about something that is understood to be safe and knowable. You, in a sense, play into a legal language which then blames the victim. Okay, so, you know, or says, okay, well, this person actually, you know, wasn't clear about what they wanted, and so this isn't rape. Or, you know, this person isn't, this person enjoys risk during sex, and therefore this isn't rape because they've opened themselves up to risk, right? So, I mean, I think that there's a way in which a legal apparatus, and I'm picking up on the question of sexual violence because in some ways it is one of the thorniest, right? But I think that you could sort of talk about this in other forms as well, in other legal forms as well. There's a way in which the question of repression is not being dealt with adequately, that we don't really want to acknowledge what desire is at any given moment, and how complex that might be, and therefore, you know, there's a limit to how much we can actually work out in legal forms. And of course, there's also the question of the fact that the contract, the idea of the contract and consent informs so many different levels of sexuality as well as everything else. So.
Just kind of taking it over to the medical side, I'm not sure that I'm going to be saying anything very different from what you're saying, Ranji, but you know, there is certainly an overestimation of the knowable, the known, whether it's, you know, and I think this is a continuation of the question that you posed in the hallway, really, kind of an underestimation of what lurks in the depths, in the darkness, and an overestimation of what can be lit up, and it made me think about our neuroimaging, and, you know, there is such a privileging of what, you know, what lights up brightly in the brain and how that can explain our experience, as though it can explain our experience fully. And I see it in other ways as well. Certainly in the realm of diagnosis, patients, they see me for 6 months, a year, and then suddenly have this question of what diagnosis I've applied to them. And in a way, I'm playing the game with them, because if we're using insurance, I have to use a diagnosis, even if it's not relevant to the work that we do. So it's
Right.
So you just have to pick the most innocuous diagnosis that is remotely applicable. But then it does become a kind of a thorny issue, because they can see what diagnosis I've picked, and then kind of what do they make of it. And for some, it's a relief to have a label. I suffer from major depressive disorder, or I suffer from generalized anxiety disorder. I suffer from PTSD. And for others, it can feel insulting, really, to be kind of reduced down to a label. There's so much more to my experience than this diagnosis or that diagnosis. And I'm not sure that there's a way to circumvent the issue. But it does make me think about how it really fits with our culture today, that there is this feeling like the answers are right at the tip of at our fingertips, really. If I have a question, I don't actually have to think very much. I can Google it. Right. Or even, just thinking about how we relate to one another. It's in the form of likes, or different kind of emojis, or swipes, right or left, right? And so, of course, we have this wish, and I would say we have a desire for that kind of knowability, for the known.
One way of thinking about the larger group of the country right now is that the election of Trump is a failure of repression. That there's a wish that everything could be conscious, that there's not something else that can be disrupted, that needs to be understood. And so to me, we're living in a time in which the group unconscious is like begging for interpretation in terms of what does this, what have we been overlooking, not dealing with sufficiently. This is what we get. It's not an attack on democracy, it's an attack on this human subjectivity, the way that man uses language. And so I'm sorry, I just couldn't contain myself.
But thank you for saying that, because I'm just wondering, I've been only a year old in this country, and I'm wondering that isn't that a form of an expression of desire, this election? And going back to the conversation that you were doing, because those were some of the conversations that I, not outrightly people saying it's a desire, but just the opiates and different conversations that I'm from UNC, so there's like the Silent Sam issue also going on, and it's been going on for nearly 3 months, 3-4 months. I mean, it's been years, but recently, but it's still there. It's still prevalent, and we have rallies and protests, but it still continues. So I'm also thinking of the same thing, but in terms of desire, and isn't that a manifestation of desire?
You mean the election?
The Trump election.
Yeah, well, I mean, I suppose voting is an expression of desire of a sort, but if that's what you mean, I mean, it's maybe the death drive in this instance.
Right? So like, let me see how much can I push, and what will be revealed. And maybe that, I think that the consequence became a rupture moment, and that's where the failure of unconscious is being felt deeply. But the whole journey towards it was very, just that entire election campaign was so performative and so visceral in so many ways. So I feel that has links with desire.
But I think there's also I could almost want to play devil's advocate and say that I think in the question of a kind of group psychoanalysis, whether that's a group psychoanalysis of the American political socius or group psychoanalysis of the women in Kashmir with the Freuds, you run the risk of asking whose repression are we talking about? And yes. The devil's advocate point here would be to say, well, is not the very proliferation now of the Me Too campaign and all of those women coming and talking about what their experiences of sexual abuse have been a different form of repression, one that responds to the the acceptance of Trump on the bus. And so as we talk about repression in groups, my point is here less to analyze what the American setting is than I think to think about the dangers of psychoanalysis insofar. And I support the nuance and the semantic play that it permits, but I also think it has no model. Classical psychoanalysis has no model for racial, ethnic, and gender difference. And so as we apply a universalized understanding of the psyche as a tool that we hold from the privileged status of being within the space of the North American institution, I think it's also important to think about that tool as being in many ways flawed. And I'm very, is the point I wanted to make here. I think I'm very interested in especially in this discussion about how, on the one hand, psychoanalysis gives us, whether or not we're looking at the interpretation of dreams where suddenly dreams are meaningful because it's not a boat on top of a house anymore, it's two symbols that are stacked on top of one another, gives us access to a privileged form of meaning making. And on the other hand, it blocks forms of meaning that we might see elsewhere. And that becomes explicitly problematic when we start to transition from individual to group, right? That Freud's individual studies of hysterical subjects make a very problematic leap when he starts to talk about hysteria for everyone. And comment, question, I don't know. I mean, I think I'm curious about the interface between those two things. Whether
she's saying she doesn't think psychoanalysis can solve all the problems of the world.
No.
Now we have to deal with that. Oh yes, it can.
I mean, I think we should say at very least here that psychoanalysis does not, its interest is not, as I understand it, to produce a terminology of the psyche. Its interest is to produce individualized narratives and understand how to read them. And so it's the psychiatric dimension that comes in when we start talking about words like epidemic or OCD or PTSD. It's a different form of a lineage. I think we can speak of psychoanalytic epidemics, but it would have to be on a different level, perhaps, or with attention to the differences in those types of terms. I don't know.
I think it's been seen as more than one thing. I think certainly from the beginning it was seen as a scientific theory, as a clinical practice, and a mode of research. And there are certainly people who operate, some people operate primarily within one of those realms, and some people try to occupy more than one of those realms. I do think psychoanalysis tries to create or is a theory of the mind, is a systematic way of understanding people, cultures, and has been. Mm-hmm. And to kind of address your earlier point, there is very much a risk of promoting a privileged stance through the use of psychoanalysis. And it's not just a risk, it's a reality. There are plenty of examples in the history of psychoanalytic thinking and practice where it's been used to diminish the other, to create a sense of the other, to diminish the other, to privilege a certain stance. And I think that at the same time there is a kind of resistance, and I use it in the non-psychoanalytic way, a protest within psychoanalysis too. I think that there are plenty of psychoanalytic writers who and I'll give you an example. I'll use the example of Melanie Klein, for example. I think she's someone who can be used, to kind of to promote a privileged stance, and I'll use it in a kind of a broad sense, perhaps. The way I've seen it is, well, if you're a Kleinian, then you kind of put this story on the patient, the story of the good breast and the bad breast, and that's the only way that you can understand it. But right now I'm reading her technical papers, and the way she writes, it's very much calling on the analyst to resist that wish to be superior, that wish to occupy the privileged position, to really approach the patient with humility, to realize that they have a very a unique story, that you're going to be learning a lot from them. And in that sense, I think there is that kind of inherent protest. Where we struggle, I think, is our ability or inability to really generalize that approach. The more popular someone becomes, the more reified their thoughts become, the more likely it is that it's used for privilege.
In your psychoanalytic work, how do you reconcile? Like, how do you reconcile like DSM and psychoanalytic thought in a broad sense? As I'm just discovering a lot of this stuff.
Well, that's also a very easy question. I don't use the DSM. So I avoid the problem, basically. But I think it's an interesting point, speaking to the international as well. One great example I've encountered, certainly within the Indian population, for example, the idea of anxiety, that you often don't quite have the same terminology for anxiety as you would. You're not going to find DSM type words when you're dealing with anxiety. It's stress, or it might show up in bodily symptoms, and the type, the kind of the portion of the body that's involved is different depending on which group of people you're working with. So in effect, trying to kind of export the DSM, I think, is a failure. I think it perverts the interaction, and I guess my way of dealing with it is to not use it unless I absolutely have to.
So what does that say about the whole biological effort entirely?
It's very flawed. I think it's extremely flawed. There. Don't get me wrong. There are aspects of psychiatric practice that absolutely are rooted in the biological. Someone who has kind of bona fide schizophrenia, there's a biological component. You can't analyze schizophrenia away. You can use analytic thinking to understand some of the things that they demonstrate, but it's not going to treat. I don't know that the DSM is the answer, and in fact, the DSM is created more to serve as a research tool, right? So that people who are doing studies can categorize people in the same way as their peers, and so that the results can be valid. And so the intent of the DSM is not clinical work.
And in fact, there's originally it was published in French with a piece by Catherine Clément, and it was called La Folle et le Saint, I think, or something like that. And so it was looking at people with from the same period with the same symptoms, and one was institutionalized. And the other was basically found to be a mystic, right? So I mean, and became the object of great reverence and this sort of thing. So I mean, I think that there is some attempt in in the international literature to try to deal with different ways in which, you know, something may or may not be an illness as such, right? Certainly in France at the moment, there's, well, over the last some years, there's Toby Nathan, the psychoanalyst Toby Nathan has become, he understands himself as being the inheritor of the position of Georges Devereux in some ways, sort of ethno-psychiatry, ethno-psychoanalysis. And he, I mean, some people are quite critical of him, but actually for in a sense, on the opposite extreme, if you like, of the exploitation of the DSM, because he, and this speaks to your point, Deborah, earlier on about anthropology, he would like to find a cultural response, an ethnic cultural response to most symptoms that appear among immigrants in France. And so I mean, you know, this is partly why he's become controversial. On the one hand, it seems very, very important to be culturally sensitive, to understand, you know, the group that the group from which this person comes, and all that sort of thing, the context from which they emerge. But he, in a sense, has gone to an extreme with this, and has been, and I mean, he's now understood to be quite a problematic figure, I think, as a result. But I think that in the early days of psychoanalysis, when it was moving around a lot, and you know, it moved. There were institutes in many places in the world quite early on. I mean, in the teens, for example, there was already an institute in India. You have a lot of letters going back and forth. I mean, this is one of the reasons why humanists find Freud's letters so fascinating. You have a lot of letters going back and forth between between Freud and from analysts around the world, or people who are trying to use psychoanalysis in some way. And they are often trying to tweak it in terms of things like family structure, right? I mean, how is it that you understand Oedipus if you don't have the nuclear family model at all, right? How is it? Is this going to be improved by using indigenous mythologies to create different kinds of theories of familial structure and that sort of thing? So I think that there are all those kinds of questions that are in play really in the early days of psychoanalysis, when psychoanalysis is not, you know, it hasn't established itself as in terms of what's classic psychoanalysis and what isn't, right? So I think that, you know, this is something that happens quite a lot in those early days. I mean, there really are, and there are certainly gatekeepers at that point too. People who say, well, that's not psychoanalysis if it didn't happen in the clinic, or if they were meeting too many times a week, or not enough times a week, or for, you know, if there wasn't payment going on, right? There are lots of gatekeepers going on in place at that moment, trying to define what psychoanalysis is and what it is not. And I mean, Deborah knows a great deal about this too. In fact, I first met Deborah at a conference in Madison, where we were talking about international psychoanalysis, and some of these topics came up a lot then. So I think that there's a way in which, you know, I suppose I would push back at Kate a little bit here as well. I think there's a way in which, if you read the history of psychoanalysis through a certain lens, there is a grappling with all sorts of questions of difference. And I mean, you know, the most profound, of course, is for Freud himself, is the whole question of what it means to be a Jew. But I think that that's not the only way in which psychoanalysis is trying to deal with that question of difference at that time.
I feel that. And so I was thinking actually about this classical psychoanalytic model defined by the gatekeepers. If that were the one that would be rehabilitated, then there's a problem there as we shift from individual to group. I'm completely on board with the idea that early psychoanalysis doesn't exist as psychoanalysis, and that it's a hodgepodge of different methodologies and practices and people exchanging letters. And I think that it's really actually quite a pity in some sense that that's been lost and been replaced with the monolith received by students who say, oh, well, why do we need to study this because Freud was wrong? And I mean, the other thing that my question was coming out of, and this is self-serving, but we were reading Manoni today and Prospero and Caliban, which is one of the first attempts to take psychoanalysis and apply it to a colonized setting. So Manoni is a member of the French Information Services, so he's part of the French colonizing powers in Madagascar. He's trying to deal with the Malagasy uprising of 1947, and he comes up with a theory of dependency, and that pre-exists the arrival of colonizing forces, so that there was something inherently wrong with the people of the island of Madagascar. And there are some things about his analysis that are provocative and culturally forward-thinking, that he does start to take account of his own space as an anthropologist, a sort of anthropologist, but a great deal of it is very problematic. And so,
but I mean, quite interestingly, Manoni had not really gone through a full training at that point, right? I mean, he had a little bit of Lacan, and Elizabeth Rudinesco writes this very interesting thing about how Manoni understood himself that his time in Madagascar was like going through a psychoanalytic training, right? So it's like this movement into another context, and the necessity of trying to find some kind of form of communication was enough, right? And then it's only when he comes back that he gets the full training, right? So yes, I hear you. I mean, of course it's problematic, and of course it's fascinating in all sorts of ways. And of course he was an instrument of a colonial government. So yeah. Wow.
Well, let's thank